talking yesterday, weren't we, about the vaccine, about hopes for that, but on the front page of the Daily Telegraph today, the news that immunity only lasts a few months, according to the results of a recent survey. It's by Imperial College London, and it shows that antibodies in the population fell by more than a quarter in 3 months. Now, we've got Dr. Hilary here to talk through this. Morning to you, Dr. Hilary, because, you know, we were all excited, weren't we, about the prospect of this vaccine. But I guess if that means people's immunity then goes after a few months, we're looking at a scenario where even if we do get the vaccine, we'll have to have, what, repeated injections, will we, to be able to cope with the fact that we could be reinfected once the effects of it wears off? We
need to distinguish between natural immunity and any immunity that the vaccine might confer. It's a big thing to distinguish there. So the research that's been done on 365,000 people being repeatedly tested over the course of time has shown that natural immunity, when you're exposed to the natural disease COVID-19, does tend to wane. So right now, about 4.4% of people, as we go into the second peak, seem to have antibodies that confer protection against the coronavirus. 4.4% compared to 6% earlier in the year, between sort of June and July. Now, that has waned, particularly in the older age groups. So being exposed to COVID-19 does not necessarily guarantee individual immunity going forward in the future. Now, that's a blow. We didn't want to hear that. Nor do we want to hear that the idea of herd immunity, which so many people have been relying on and saying, well, you know, the more people who get it, the better, we'll all be fine in the future, that's blown out of the water as well. So we've got to forget that getting COVID-19 will make us immune going forward. That's a real blow. Now, the vaccine is a different story. The vaccine does tend to give a strong immune response, according to the trials that have been done so far. However, those people who have been exposed in the past can't guarantee that they're immune. They need to know that they can get reinfected and that they can give the infection to other people, so they still need to abide by the guidelines that have been suggested for everybody.
OK.
Hills, which vaccine does this apply to? Does this apply to all the vaccines we hear about? Because we know Oxford is apparently one of the main ones. Does this apply to the Oxford vaccine? Is that the one we're talking about?
Yeah, the one we're talking about right now is the Oxford University AstraZeneca vaccine. So that's now in phase 3 clinical trials. That means that thousands of patients have had, volunteers have had the vaccination in different countries around the world. And the responses so far are showing that they get a good immune response. We don't yet know how long it lasts. They may have to give this twice a year going forward, but the immune response is good even in people over 55, and that's really critical because it's the older age groups that are more vulnerable. So if they're getting a strong immune response, that's good news, and it also looks to be safe. So that's something to look forward to, and that's a bit of good news on the horizon amongst all the other...
It's really frustrating, isn't it? Because we wake up, you know, yesterday we were getting hopeful about a vaccine. We heard it's going to be here in a few weeks. The NHS staff might get it a bit earlier than most of us, or a lot earlier than most of us. Now we hear this. I mean, it is frustrating. I think for viewers and people at home going, oh, hang on a minute, is there a vaccine? Is there not going to be a vaccine? When's it coming? But I think it just tells us how complex this issue is and how much, you know, people like yourselves and scientists in laboratories are learning things every day, aren't they, about
Absolutely. This is not something you can just create at the drop of a hat. Most vaccines take 20, 30 years to come to fruition by proving that they're effective and that they're safe. So this has been rolled out extremely quickly. People all around the world are working very hard to produce an effective and safe vaccine. Of course, what we don't know, it may give an immune response, but we don't know how strong any antibodies will be in preventing infection and stopping reinfection. Again, this is something we don't yet know, and work will have to be ongoing. It's going to take many, many months, possibly years, before we know for sure how effective the vaccine is, not just in preventing infection, but preventing serious consequences of COVID, which is what we want.
And also, you know, when we're talking about learning more the whole time, we're learning more about the effects that people are left with once they've had coronavirus. In the papers today, it's talking about this brain fog that some people are left with that can knock 8 points off your IQ. It can age the brain by 10 years. So even those people who've had the virus, recovered from it, but still coping with the effects of it.
Yeah, it's important to stress that that figure relates to people who were very seriously ill with COVID-19. So they were often on ventilators, they were often in intensive care. So a very small proportion of people with COVID-19 had that level of effect on cognitive function. So reduction in age of the brain, reduction in IQ. However, Many people, thousands of people, have reported mild to moderate symptoms and reporting ongoing chronic brain fog. So failure to concentrate, not sleeping very well, forgetting everyday things, affecting their daily life many months after having the infection. So this is a major story, I think. It's of great concern, and it's one of the good things that have come out of the app, the symptom tracker app that has been run by Imperial College. We know that people are reporting this. It's quite a common thing. And again, it's why we've got to take COVID-19 very seriously.
And in some cases, I read that it can lead to Parkinson's, and they've not just been one-off unique cases, but there's been a few cases now around the world where people have months later being diagnosed with Parkinson's and they're linking it to their experience of COVID.
Yeah, again, I think the data needs to be corroborated in further trials. But yeah, I mean, Parkinson's disease can be caused by a number of factors. It can be caused by repetitive head trauma. It can be caused by recreational drugs. It can be caused by viruses. And perhaps that might include COVID-19. We need to wait and see.
This brain fog thing, is it normally a consequence of quite a few viruses then? This is not something that's unique to coronavirus?
No, people who have ME, for example, chronic fatigue syndrome, often describe brain fog. People with fibromyalgia, people with all sorts of other conditions can report a sort of rather nebulous symptom of brain fog. It's failure to be able to concentrate accurately, to be able to think in a more focused way. So it's non-specific and it's difficult to measure. However, it does affect people's lives, so it needs to be taken seriously.
Hilary, someone who's on a lot of the front pages this morning is Victoria Derbyshire, the broadcaster. She's talked about the fact that she's going to be, or she was planning to break the rule of 6 for Christmas. In an interview, she was asked about this, and she said, if the rule of 6 is still in place at Christmas, we're breaking it to have the rule of 7. We just are. She said, joining me, my husband and our 2 boys will be my mum, her partner and my husband's dad. And she's talked about how they were going to get a thermometer gun to make sure that it was safe. But she has since apologised for this. She's put out a couple of tweets, actually, to say, I'm starting the day by saying I'm sorry. A few weeks ago, the Radio Times asked me, amongst other things, what would potentially happen at Christmas with my own family if the rule of 6 was still in place. I talked about my mum, her partner and my dad-in-law spending it with us, making 7 in our home in a Tier 1 area. It was hypothetical, however, I was totally wrong to say it, and I'm sorry. We will, of course, continue to follow whatever rules are in place on December the 25th, because, you know, what kind of message is that sending out? The difficulty is, isn't it, when we're coming up to Christmas, we're looking at the restrictions that are in place. Everyone's going to want to spend time with their family, but we do still need to be cautious about the restrictions and making sure that we're not passing on the virus to people.
For most people, unfortunately, Christmas is no longer a religious celebration. It's a party. It's an excuse for a party and for getting the family together. And I'm afraid that any excuse for getting a family together and having a party is a recipe for disaster as far as prevalence of the and transmission of the virus goes. And, you know, I'm really glad she's retracted the comment because, you know, we've seen people break the rules before and it's received huge publicity and it's encouraged people to go out and flout the rules that are there to protect the community at large. So I'm glad she's retracted it. And I think what's important to know is that, you know, whilst people are saying, we know what the risks are, we're going to have 7 anyway, although it's meant to be 6, other people will say, well, if they're having 7, we'll have 8. And so it gets out of hand. But I want people to remember the fact that 630 people, healthcare workers, sacrificed their lives in the first quarter of this year fighting coronavirus because they picked it up from patients in hospitals. Now, if we forget what the NHS has done so far and say, well, I don't care, I'm going to take the risk, I'm prepared to do that, to me, that is a selfish way to go forward. And I think that we all have to remember that we're only going to get through this if we're careful about how we behave, how we socially distance, how we protect ourselves and other people. That's the only way forward. That's the only way we're going to get out of this.
It's interesting, isn't it? And I think, you know, a lot of people, most people, you'd like to think would agree with you, Hills, but I do wonder whether there is a general feeling out there, particularly when you think about elderly parents and grandparents. It is Christmas, and taking the religious aspect of it aside, it is the time that people are used to seeing their grandparents. And, you know, we heard from the lady up in Barnsley last week, I know you spoke to, and she put it quite bluntly, Maureen, who said she might be dead this time next year. She might not even be around. And I think that there is a feeling amongst some families, despite this severe catastrophe that we face ourselves with, that actually when it comes to Christmas, I might just take that gamble and go up and see grandparents in Yorkshire or invite them round or something. And And I'm with you, Hills, but I just think I worry that is something that people are thinking about.
I completely understand that. I completely understand that. And it is about a balance of risk. And there are cases where we need to care for our elderly and we need to look after each other's mental health. And sometimes the mental health aspect supersedes the risk of COVID-19 transmission. And I think it is a balance of risk. Well, people have to be sensible. But the more people who flout the rules and have big parties, the more prevalence we're going to have and the longer this is going to last.